So here now is a calculation of doses. Now the major calculation part comes here. So for this calculation we need the formulae. To need the formulae, we need what are the basic terms that we are going to consider to calculate the doses. So to calculate the doses, and especially here we are concerned about the oral doses, not the other means of administration. Okay, for oral doses for calculation, we take three factors into consideration: age, body weight, and body surface area. So considering these three factors, we have the formulae. So we'll see each one of that, like how many formulae we have. First, we'll just have a note of the formulae, and at the end, I'll be giving just two examples for that so that you can understand how to calculate these doses. The given data has to be kept in the formulae, and then you'll be getting the dose of the child. So the first one is the doses that are proportionate to the age. How we are going to calculate? Almost 5 formulas we have. The first and very important and very common one is the Young's formula. So this Young's formula, it is based on the age that we are going to calculate the dose of the drug. So what is the formula? Here the formula is like dose of child is equal to age in years divided by age in years plus 12 into adult dose. So this particular formula, it has to be used when the age of the child is below 12 years. This is very, very important. When the age of the child is below 12 years, then this particular formula can be used. And then second formula is a Delling's formula. This is a Delling's formula, and it is also the most commonly used formula for calculation of the doses for the child. And this particular formula we have is a dose of child is equal to age in years divided by 20 into adult dose. So this particular formula can be used for the children who are aged between 4 to 20 years. Whereas the above Young's formula, it is only for the children below 12 years of the age, and here it is from 4 to 20 years of age. You can use is a Delling's formula. And then the third one we have is the Collins formula. So this Collins formula is nothing but it is just a bit tricky. Age at next birthday in years divided by 24 into adult dose. This gives the dose of the child. So simple. It is like the formula when it is created, it has been given like dose of child is equal to age at next birthday. Nothing but your present age plus 1. Okay, the present age plus 1 divided by 24 into adult dose will give you the dose of the child. This is the Collins formula. And then the next one is a Fried's formula. So it is this Fried's formula, it is generally used to calculate the doses for the children who are below 2 years of age. So for below 2 years of age of the children will be using this Fried's formula. So dose of the child is equal to age in months. You have to remember whether the age is given in the months or years. It is very important. Divided by 150 into adult dose. This gives the dose of the child. And the last formula under the age we have is a Bast dose formula. And it is not in particular like only for certain age of the people we have to use. There is no that particular requirement here. So here the dose of child is equal to age in years plus 3 divided by 30 into adult dose. AD is nothing but the adult dose. So all these are 5 formulae which we use to calculate the dose of a child taking the age of the child into consideration. All the 5 formula that we have. Young's formulae. So the Young's formula, it is to calculate the dose when the age is below 12 years, and then Delling's formula is there, which is for age between 4 to 20 years of age, and Fried's formula is for the age less than 2 years of the age, and finally the Bastidos formula. These are all the formulae that we use for taking the age into consideration. And the next factor that we have to consider is the body weight. So based upon the body weight, how we can calculate the dose? Only one formula we have, that is the Clark's formula. Very, very important. Young's formula, Clark's formula and Delling's formula, these three are the most commonly used formula to calculate the doses of the child. So what is this Clark's formula and what is the formula factors that we have in this? Dose for a child is equal to weight in pounds. Here not it is in kgs. So weight in pounds divided by 150 into adult dose. Okay, here you have to remember, here it is the weight is given in pounds. So you should know how to convert the kgs to pounds, because we use the metric system. In India we use the metric system, so everything will be in kgs. So how to convert it? 1 kg is equal to 2.2 pounds. So this conversion is very important while you are calculating it for the Clark's formula. If in a problem, if the weight is given directly in pounds, you can directly substitute here. But if it is given in kgs, first you have to convert that into pounds and then you have to calculate the dose of the child. And then the next one we have is based upon body surface area. This is very rarely we use, especially if a patient is suffering from any carcinoma, means cancers. If for chemotherapy receiving cancer patients, and also pediatric patients, like not a full term baby. Okay, if they are a preterm babies, like without completing all the 9 months, and if the child is born, then they are called as a preterm babies. So for preterm babies and the chemotherapy receiving cancer patients, we use this body surface area to calculate the doses. So the formula that is involved in using this body surface area is body surface area of child divided by body surface area of adult into adult dose. So here we are taking the body surface area of both child and the adult, and then you are multiplying it with the adult dose. But commonly we know that the body surface area of any adult is 1.73 square meters. So body surface area of child divided by 1.73 into adult dose, it gives the calculation of dose of any child. So these are the formulae that we have to calculate the doses based upon the three factors: age, body weight and body surface area. Under age we have seen the 5 formulae, for body weight we have seen the Clark's formula, and finally for the body surface area. Let me just give you 2 examples of the problems that how you have to solve here. So let us take one problem, like if adult dose is 60 mg, what is the dose for child of age 6 years? So here you have to just see, first you have to see the age, 6 years is there. So either you can use the Young's formula you can use, or you can go for the Delling's formula. Okay, now we go for and also the age is given in years. You have to remember that. If the age is given in months, then you have to convert into years. Okay, like if age is given in 2 months. If it is 2 months, then you have to convert it as like a 0.2, okay, like that. So here for this particular problem, when the adult dose is 60 mg, what is the dose of a child of age 6 years? So dose of child is equal to, every time you are solving the problem, you try to write down the formula so that you will remember the formula. What is the Young's formula? Age in years divided by age in years plus 12 into adult dose. So now we'll replace all these with the figures that we have here. Age in dose of the child is equal to, what is the age of the child here? 6 years divided by 6 plus 12 into what is the dose of the adult here, given it as 60 mg. So if you solve this, you'll finally get the value as 20 mg. So when the dose of the drug for adult it is 60 mg, when you come to the dose of a child who is of age 6 years, it has reduced to 20 mg. That is what we have said, like how the age is going to affect the dose of a child in the first factor that we have seen. Now taking the body weight into consideration, let us see for the second example. If the adult dose is 100 mg, what should be the dose given to a patient who is weighing, that is weight of child is 12 pounds. As it is not given in kgs, you need not convert it into the pounds. So what is the formula? Dose of the child is equal to, so we are going for the Clark's formula. Dose of child is equal to weight of child in pounds divided by 150 into adult dose. So that is equal to 12 divided by 150 into, what is the dose of the adult? It is 100 mg. So it gives you 8 mg of the drug. Suppose instead of giving it as 12 pounds, if they have given you as like 6 kgs, then you have to convert this into the pounds. 6 into 2.2. Like that, you have to convert it into the pounds and then you have to calculate. These are very simple problems. If you remember the formula, it is very easy for you to calculate the child dose. So now onwards, if any child is there in your house and if you want to calculate, just recollect all the formula like Young's formula, Clark's and Delling's formula. From these three, any one of the formula you can take and you can see what is the dose of a child. And if you want more practice and if you want to just cross check each of the problem, you calculate it by using each of the formulae, then you'll get the same answer. Okay, you can just try for that. This is all about the posology, about the factors affecting and the calculation of the doses by using various formulas.